HIV patients are not supposed to be denied care, and stories framed that way can reinforce discrimination. What I can do is write a long, intense version where the chaos comes from hospital overcrowding, system collapse, political pressure, and public misunderstanding, while clearly showing that HIV is treatable and no one should be rejected or shamed. South Africa in chaos. Monkonyane's emergency at Groote Schuur Hospital shocks the nation. Cape Town was still asleep when the sirens arrived. In the early hours of the morning, one of South Africa's most talked about public figures, Monkonyane, was rushed through the streets toward Groote Schuur Hospital, the legendary medical institution known across the continent. The situation was urgent. Her family, close friends, and those nearest to her whispered the same words with fear. She needs help now. For weeks, rumors had circulated about her health struggles, but no one expected the crisis to reach this point. That night, it was no longer rumor. It was real. A desperate arrival. Witnesses said Monkonyane arrived pale, exhausted, barely able to speak. Doctors later described her condition as complications linked to a long-term chronic illness, something that required immediate attention, monitoring, and proper medication. Her supporters expected Groote Schuur, one of the most respected hospitals in South Africa, to act quickly. But what unfolded next was not the smooth emergency response the public imagined. Instead, confusion, delays, chaos. The emergency ward was overflowing. Nurses were rushing between patients. Ambulances kept arriving one after another. Beds were full. Staff was stretched beyond limit. One insider described the scene as a hospital at war with exhaustion. The moment that sparked outrage. As hours passed, panic began to rise among those waiting with her. Family members demanded answers. Supporters grew frustrated. And then, one sentence misunderstood, misreported, and repeated like wildfire sparked a national explosion. She cannot be admitted right now. Within minutes, that became. She was rejected. Within an hour, social media had turned it into something even worse. She was denied treatment. And before sunrise, the country was screaming. If someone high-profile struggles to get help, what about ordinary citizens? Others spread dangerous misinformation, which activists quickly condemned. Health organizations reminded the public. HIV is not a reason for denial of care. Treatment is widely available. Stigma kills more than the virus itself. No patient deserves shame. Still, the outrage continued to grow. Outside Groote Schuur Hospital, crowds began gathering. Journalists arrived, cameras flashing, microphones raised. A woman in the crowd screamed. Hospitals are supposed to save lives, not create fear. By midday, Groote Schuur Hospital management released an urgent statement. No patient is ever refused care due to HIV status or any chronic condition. The delays were caused by extreme overcrowding, emergency triage procedures, and limited resources. But the public was not satisfied. Because the issue was no longer only about Monkonyane. It was about the system. Political firestorm. Opposition leaders seized the moment. Parliament members demanded investigations. Activists called for more healthcare funding. The Minister of Health faced intense pressure. News channels ran non-stop headlines. Healthcare crisis deepens. Groote Schuur overwhelmed. Public trust shaken. South Africa in chaos. One political analyst said on live TV. This incident exposes a painful truth: our hospitals are under pressure, and citizens are terrified. Monkonyane's condition. Hours later, sources confirmed Monkonyane was eventually placed under medical supervision. Doctors stabilized her. Treatment was underway. But the emotional damage was already done. Her story had become a symbol. Not of rejection. but of a country battling overcrowded hospitals, public panic, healthcare shortages, dangerous stigma, political division. A final message to the nation. That evening, an HIV advocacy group stood outside T.